Hi, I'm Todd Cohen, the inventor of the Easy line of products. Here at Heart Rhythm 2017, where Easy Holder, the first in the Easy line of products, is being launched. This is a transcendent product. It's more than an organizer. It's a product that will help with the efficiency of your EP procedures and your implants. Specifically during EP procedures, you open the sterile product, you take off the adhesive, you stick it down on the patient, and then any size of the standard EP catheters, going from about 4 French to 12 French, can fit in this device. You basically can hold the catheter in place. So you have your EP catheters, they go in place right outside the sheath. And then if you go and do a simple EP study and you shock the patient, typically the catheters go flying out of position. They may even be flying out of the groin. It helps hold those catheters in place so you don't need to reposition them. In addition, it can hold the catheter in position for the His bundle or any potentials. You can free up your hands if you're doing an ablation. This little device does a feature of a robotic system which can hold the catheter in position. And that's what this does. So if you're doing a flutter ablation or you're at a potential, you can hold the torque. It will hold that torque in the device. You can pull on the device. There's a lot of pressure, and the catheters are very hard to move once they're in. They're secure. They're easy to pop out and pop back. And now we're going to switch to implants. So very useful for EP procedures, and for the implant, it is equally as effective. So the implants, the same thing as lead dislodgement. Most operators have multiple leads going through a single site, such as the cephalic vein, the axillary vein, or even the subclavian through a single stick. So if you're doing a simple pacemaker and you have an atrial and ventricular lead, you can put the ventricular lead in, you can take that lead, you can put it in and keep it in position. I usually like the stylet to give it a little bit of firmness, and then you can position the next lead, and you put that lead in position in here, and you get that in position, and when you're done, you pop the leads out. Everything's in position, nothing's dislodged. You save time and efficiency for the procedure, and you just suture it down. Now let's talk for the BiV. That's one where leads are always dislodging. When you're slitting the LV lead, you can have that lead work on it. It can hold that lead in position. You can even be holding the other leads in position, and you can slit and pull back, and you don't need a second person for the slitting procedure. The Easy Holder is one of these transcendent devices, very simple, very inexpensive. It's approved for use in the US, and I hope you're going to love using this device.